Refractory anaphylaxis is defined by the persistence of symptoms after 3 subcutaneous injections of epinephrine. Clinical case. Patient information. Name: Emily. Age: 9 years old. Gender: female. Weight: 30 kilograms. Medical history: known allergy to peanuts, diagnosed at age 4. No other significant medical history. Emily was at a birthday party, where she accidentally ingested a small piece of a cake containing peanuts. Within minutes, she developed itching, swelling of her lips and face, and difficulty breathing. Her parents administered her epinephrine autoinjector immediately, but her symptoms did not improve. Upon arrival at the emergency department, Emily appears anxious and is struggling to breathe. Her lips and face are swollen, and she has audible wheezing on auscultation. Her blood pressure is 80/50ths of a millimeter of mercury, heart rate is 140 bpm. Respiratory rate is 28 breaths per minute, and oxygen saturation is 88% on room air. 1. Immediate intervention. Emily is placed on high-flow oxygen via nasal cannula. Intravenous access is established, and a bolus of normal saline is initiated. A second dose of epinephrine is administered intramuscularly. 2. Response assessment. Despite initial interventions, Emily's blood pressure remains low, and her respiratory distress worsens. A third dose of epinephrine is administered intramuscularly, without significant improvement. Management decision: Emily is promptly admitted to the Pediatric Intensive Care Unit for further management of refractory anaphylaxis. In the PICU, she is started on an epinephrine infusion, in addition to aggressive fluid resuscitation. Despite maximal medical therapy, Emily's blood pressure remains persistently low, indicating refractory shock. In addition to the interventions mentioned in Emily's case, several other treatment options can be considered for refractory anaphylaxis. If the patient remains hypotensive, despite maximal epinephrine and fluid therapy, other vasopressors such as norepinephrine, vasopressin, and dopamine can be considered to support blood pressure and perfusion. In cases of profound vasodilation, methylene blue, an inhibitor of nitric oxide synthase, and guanylate cyclase may be beneficial. It can help increase systemic vascular resistance and reduce vasopressor requirements. For patients unresponsive to conventional resuscitative measures, ECMO or operative cardiopulmonary bypass can be considered to provide circulatory and respiratory support. The girl's condition has returned to normal. How to express this situation with a sense of humor? Well, it seems our chocolate-loving daredevil just had a run-in with her arch-nemesis. Who knew Coco could be so sneaky? But don't worry, folks, we've got her back. Dash and her heart rate's not the only thing that's normal again.